Welcome to the Don't Call Me Midlife podcast.
Okay, ladies, we are going to welcome back Allie Edwards from Renova Med Spa Aesthetics here in Castle Rock, Colorado. She was on before, but we had her come on again to talk about the O shot, and it is gonna rock your world.
It's gonna be. I learned so many things. Like I know, Nicole, like a lot of our body and emotions change during this age, but I didn't know that particular area changes too. So this is actually really useful information. Being proactive, ladies, about our bodies, so that you're gonna really, really enjoy this. Allie is a sweetheart. Has so much information.
Okay. Good morning, ladies. Hi.
Hi,
Morning,
Nicole.
Allie.
Hi there.
Hi. Okay. Honestly, this episode is going to rock your world. Literally. I mean,
Wow. That's aggressive,
buckle
Nicole, for
up.
this morning.
That's all I'm going to say. Buckle up.
Okay. We're excited. We love Allie. She's been on here before. We just had to have her back because she's one of our faves,
Thanks,
right?
guys.
Yes, you give so much good information. And I think you give so much more to our ladies than we realize. And I can't wait to have our listeners learn all about the O shot. Yes.
Yay. Super excited. So what's in your cup,
I
Nicole?
just have a bunch of questions and curiosity. Like that's what's in my cup.
Oh.
Figuratively
today.
Yeah. I'm so curious. What about you, Alex? What's in your cup?
So this is sort of funny, and I know it's not the healthiest drink, but my family has been obsessed with Dr. Diet Pepper. And I like stocked my fridge with it for the summer. I know it's not healthy at all, but it is like my favorite soda if I am going to drink it. And my mother-in-law, we got this from my mother-in-law because when you go to her house, it's the funniest thing. She has like the cases of soda in her fridge that is like root beer, Sprite, Dr. Pepper, because she drinks a Dr. Pepper like every single day. So it's soda. It's soda. I don't care.
Enjoy. You can put whatever you want in your cup.
Yes. What's in your cup, Allie?
I think I did this last time too. I have, and I came prepared this time. I have the Amino Energy.
Oh,
So I drink it
Ooh.
every morning. It's like my version of coffee, I guess. And it has like aminos. It's got a little caffeine. It's got a little
is that grape
guarana,
flavored?
all the things. This one is grape flavored. It's my favorite flavor. But I have a nice little tumbler of it every morning.
So you don't drink coffee? This is
I don't
Instead of
drink
coffee?
same question.
We're like,
What?
wait, what? No
I know.
coffee? Okay, let's definitely link that in the show notes. I mean, I could never stop coffee, but I'm interested in an
Yeah.
extra little boost.
Like a chaser.
Yes, a chaser.
Like, I could do a chaser. I could definitely do a coffee
Right.
chaser so I don't drink coffee in
There
the
you go.
afternoon too.
Okay.
My goodness. Okay,
Are we
love
ready to
that,
dive
Allie.
into this?
Mm,
Okay.
Yes,
All right.
you start, Nicole.
Well, I
Talk
don't
all
really
about
know
it.
anything about it, but I do have lots of questions. So we have Allie, and she is the owner of Renova Med Spa here in Castle Rock. And she has something called the O shot that she offers in addition to other services. And we brought her on here because this is a hot topic, literally and figuratively. And so we just want to educate everybody on what the O shot actually is. Gathering from the name, when you say "oh," I would think orgasm. So I don't know if that's all it entails, but I would like to hear a little bit more from Allie on what exactly the O shot is.
okay. Look.
Is that the real name, Allie?
So,
What's the real name?
it is the real name, O-Shot. So, there's a
Oh.
doctor that coined it. The O-Shot, there's the
Uh-huh.
P-Shot, there's other shots. But
Wait, is P for what?
penis.
P for the boys?
Yeah.
Oh,
Okay.
okay.
Yeah.
I didn't know
So
that.
there is one.
Huh.
We don't
Okay.
do that, so you can put that one out there. Don't come to us.
Okay.
But
Don't come to us.
there is don't come to us for that. But we do definitely do the O shot. And it was honestly a few years ago that we decided to bring it on because I realized how, as women in midlife, we start going through changes. And I think for a long time, people just chalked it up as normal. Like we have increased vaginal dryness, we have decreased pelvic floor strength. So we're leaking, we're wearing pads when we work out, all of these things. And then sex becomes more of a chore and it's not as enjoyable. So like decreased libido, but also like I'm not getting orgasms or nothing happens anymore. And so, and again, I think people just chalked it up to, hey, this is a normal thing. And I guess this is how it's going to be the rest of my life. And with the O shot, I found that that's not the case. You can continue to enjoy having sex. You can revitalize that area of your body to do what it used to do. And so I think I'll go to that, like how we do it. What we do with the O shot is that we use PRP from your body, your blood, which is platelet-rich plasma. So we draw your blood, we spin it, and we get the plasma, the platelets, and growth factors from your blood and inject it into the clitoral hood and the vaginal wall. That sounds
extremely painful. Yeah.
That sounds scary.
It sounds
Allie.
scary.
That sounds scary.
I get it. I totally, and honestly, until you do it, it will sound scary, but I don't know that there has been a person that's come in that's like, oh my gosh, that was the worst experience ever. I'm never going to do it again. We numb the crap out of that area. And
how do you numb?
Honestly, so we have a topical.
Is it a
numbing.
topical or is it another shot? Okay.
So we do a topical numbing. And we also do another shot. So while your blood is spinning, you're numbing. And interestingly enough, that's a highly vascular area and it numbs fairly quickly.
Okay.
And so because of that, usually people are numb enough with the topical. We also do a little shot right before just so that it's a little extra numb.
Mm-hmm.
But honestly, by the time we're done, people are like, wait, is that it? We're done. You did it. And so, and we do everything to make sure that you're the most comfortable that you can be. I think the most uncomfortable is just that area and having somebody in that area. But as women,
yeah, but we've all had babies. I think that's,
like,
or just a trip to the gynecologist. Somebody's always in there at least once a year.
You've had your pap smears, you've had your IUDs, you've had your babies, all of the things. There's people that's been there, you know? And so, and we're all nurses, nurse practitioners there at our clinic. And I mean, I've seen thousands of vaginas. So
yeah,
it's,
we trust you, girl. Can we backtrack one step, Allie? So what is the most common sort of problem, I would say, that women come to you? And I'm curious, the age range. Is it midlife? And do we see these problems that you talked about in the beginning? Some of those, it sounds like, could also be due to like us having babies too, right? And then also, I actually didn't realize some of these, I don't want to say problems, or things that happen to our body were because of age, right? I like how you said we just sort of normalized it, right? But knowing there's probably a listener lady out there that's like, oh, I didn't know that was part of like the aging process per se, right? But it is. And that's why we wanted to do this episode, letting people know that this can happen, but it doesn't have to happen, right? So what is like the age range, and what is the most common like situation that people come to you? Because I'm sure you have to ask that, right? Like, what are they dealing with?
Absolutely. Honestly, it's more toward, so I have two groups. I have postpartum. So, younger moms that there's been a lot of trauma down there and going on, that decreased sensation, decreased stimulation. So there's that. And I will say those young moms, the results for them are like off the charts just because they're young, they have increased collagen, their tissue's still like young and vital, all of those things. My second group are my perimenopausal, postmenopausal women. So,
That's us.
right? That if you think of the things that you're seeing, like on your face, on your skin, all of the things, those are aging. So that area is also aging. So the tissue,
That's so
well, no one's
fascinating.
looking at their hoo-has, all the time, be like, oh, look at that, sagging a little more. Like, no one sees that.
Right.
My
And
mom likes to fill me in on things that will happen to me. So yeah.
oh, see, there you go. Your mom can tell you.
My mom doesn't, so I have no idea about this. She didn't even tell me to shave my legs, guys. So I had no clue. So yes, thank you.
I got you, Alex.
Thanks, Andrea. You got me. Okay. So this is so interesting. So going back to the midlife ladies in perimenopause, you see just physical changes, right?
And a lot of them. So if you think of tissue laxity, so like we all start getting gels and things like that. Tissue laxity is happening in your vaginal wall, outside, like on your labia, all of those things start just changing a little bit. And due to hormones and things like that, you have increased dryness in that area. And because there's laxity, there's a decrease in like wall strength, your pelvic wall strength. So you have more incontinence, you have the dryness is painful just in general, but not even to mention like in sex. Like that's very
That scares
painful.
me.
And so like there's no amount of lube. You can ask these ladies, it hurts your heart because they're like, there's no amount of like just lube that you can
Really?
use that can help. And it hurts. It's like the Sahara down there. And
It just sounds uncomfortable, even if you're just sitting there, like
just normal. Just normal.
like a dry mouth is
I
uncomfortable.
think it hurts. And then add that on to your like to your like sexual wellness is
okay.
hurts.
I'm sort of dying.
Yes, your dry mouth does hurt.
Right.
It does. I mean,
But so those kind of things, and if you help with like tissue regeneration, so that's what platelet rich plasma does. It goes in and it boosts. It gives you like a nice little, I don't know, like not a shock. Shock is a bad word to use for that area, but shocks your.
Yeah. Well, maybe it could be good.
Like it does. It stimulates your nerves. It stimulates your tissue to regenerate and become tighter. It helps. Like 9 out of 10 women says it helps so much with the dryness down there, and especially like right off the bat. Some of them it takes a few times, like for the tissue regeneration and the nerve stimulation, like 2 or 3 times doing the O shot. But the vaginal dryness, like first time, just awesome.
Does it change physiologically? Like when we talk about laxity, does it just kind of like tighten things up? Does it go from like, for the older ladies, like, from a U back to a V? Like, does it like lift it a little or?
Yes.
Okay.
Yeah, no, that's a great question. No, it does. It, in the sense, so the 2 places that we inject it that I told you about, so the clitoral hood, so to give those nerve stimulation in the clitoris, and then where we go in the vaginal wall, like near the G spot, they're intended for like that nerve stimulation, but because it goes near that vaginal wall, it does tighten up that tissue in there. We're not doing anything like externally.
Okay.
So like we do have other things that we can do for that. We have machines. And so we do like to incorporate our O shot with some of our other services to get all of those things like holistically taken care of.
Yeah. I had a friend that did, what's it called? Vaginoplasty?
Labioplasty.
Labioplasty. Yeah.
Wait, what is
That's
that?
when you have little
What is that?
floppy labia and then they tighten it up.
Oh.
It's like a lip lift.
It's like a facelift. It's a facelift for your gine.
Poor Alex is dying.
Well, I am so glad that that's out there for people.
Listen,
I think you'd be surprised how many people get it.
what, the lip lift?
Yeah.
Wow.
Labiaplasty? Yeah.
Labiaplasty.
Yeah. I don't know. It's probably, yeah. Well, I think if you have children like that, it's all exacerbated, right?
I think if it makes you feel better, do it,
Yeah.
right? Like we're at the point, right? If you're going to get Botox, if you believe in it or not, it doesn't, if it's going to make you feel better and more confident to have that area nice and tight, then do that, right? Because sex is something that is at our age, like really important to connect with our husbands on, right? I feel like we are at a stage where we're so busy. Our kids are like almost always around. And Nicole and I have talked about this on other episodes, right? To have that connection is the one thing that we do have with no one else in this world, right? Hopefully, is with our husbands. So I think making sure that you really, really have a healthy sex life, whatever that looks like for any of you, it is really important to have a healthy relationship. I believe.
I agree. And I think that it shouldn't just be, one-sided, because I think that as women, we get to a point, and I think that that's what's happened historically, is that like, well, it's just going to suck from now on, and I'm just going to do it because I love my husband and I am a good partner and I want to make him happy. But that's not the case. It doesn't have to be like that. And I think that as women, we become unselfish, and we've always been unselfish, like with our children and our families and all of this stuff. And then you just feel like, well, into this part of my life that this is where it is now, like just have to suck it up. And it's not.
No, we're gonna
that's
fight.
not okay. That's not okay. Women can enjoy sex too. It is okay. It's okay. I will say that. Like that is, we deserve it too. Everyone deserves it. You deserve to have that intimacy with your husband, right? So tell us a little bit. Do you know anyone like personally who's gotten this shot, or do you get feedback? Like, do you have surveys from your clients, or what do you do?
Surveys.
Post 1 to 10. I don't know.
How's that orgasm?
Was last night?
How is your sex life?
How was your weekend?
Right.
No, honestly, we follow up with our clients to make sure that, hey, how's everything going? Did you get what you expected? That kind of a thing. I will say I myself have had it. And honestly, the first time that I got it was really more I was trying to see if it would help strengthen my pelvic floor. I have like the whole peasing issue where I sneeze and I pee. But, and so I was thinking, oh, maybe it'll help more for that. So the first time I did it, honestly, I can say it was kind of meh. Like maybe it helped with my pelvic floor strength. Maybe it didn't. I didn't really see any change sexually. Then I did it. So this is why we recommend 3. So that it can get to its optimal. So the second time I did it, I kind of was expecting the same thing. And, so probably within a few days after, my husband and I, and, I never had any issues having an orgasm, but I couldn't stop. Like my husband was long done.
What? Can you repeat that?
It didn't stop. And I I've had multiple before, but I almost passed out. I was like just dying, and my husband was long done, and I was like, just be quiet. Still going. And
that's crazy.
He is so proud of himself because he's thinking like, yeah, I did this. And I'm like, yeah, okay, sure. But
you're like, my industry, right?
I was like, oh my gosh, I'm going to die. Like, I don't know. And I pray that everyone feels something like that sometime in their life.
Right.
But honestly, it went from like, I was probably like a good, 7 or whatever to like 20.
Wow.
And
so is that like every time? Like, does the shot wear off, or like
how do you space it
how
out?
does it work like that?
So, honestly, for a long time, it was like, that was a constant. And then I saw it kind of trickle down, not necessarily like, it wasn't like it didn't wear off necessarily, but I think we talked about this, like it just plateaued.
Mhm.
Like, oh,
Wasn't as
we're still
intense.
good.
Mhm.
It wasn't as intense.
You went
So
from
I'm
like a
definitely
18-year-old orgasm to maybe like a 32-year-old orgasm, would you say?
there you go.
Okay.
There you go. But honestly, I think that
Very technical, Nicole.
I don't know, at 32, like at 32, I don't know that I was enjoying it as much as I am now. Like it,
Yeah.
Right.
Chef's kiss.
I'm a fan. Yeah.
So how do you space
but
them out?
honestly, I think
Like,
I would do it
yeah.
again.
Okay.
So for me, after that second time, I reached that optimal result. So I don't feel like I
Okay.
needed a third one right away. It's been about over a year now, and I feel like I would be up for another one.
Okay. But between the first and second,
just to kind of,
Wow.
Is there
and
like
honestly,
is it kind of like Botox where you're just like, you start to notice, or is there a recommended time? Like,
yeah, no.
okay.
So usually after once you hit like your optimal, like where you want to be, then it's yearly. So
Okay.
like we recommend just like a yearly maintenance. But honestly, sometimes people are like, oh, after 6 months, I need a little bit of a boost, that kind of a thing. And I mean, like what you were saying, just like Botox, it does, if you never do it again, that's fine. It's not going to hurt anything. It's not, if anything, it helped put you that much further along, like in terms of tissue regeneration. But if you keep it up, good for you.
Yeah. I mean, I know we're focused.
Are there any side
No, go ahead.
effects?
Sorry, what?
Are there any side effects of taking it? Like anything, like you can't have sex for a certain amount of time, or things like that you would feel like that naturally would happen to your body?
So downtime wise, like right after, there actually is no downtime. I always tell the ladies that, if you want me to tell you there's downtime, I'm happy to give you a hall pass, like just to tell your husband, like it's a week. I can't. 1 week, I can't.
Right.
But there really isn't. And a lot of people that we have done, because right after you do it, you have that inflammation, and there's actually increased sensation for those like first couple weeks. But there's no downtime. You could have a little bit of spotting, again, more from the injection site, not because you're spotting vaginally. Like you should not have any vaginal bleeding. The nice thing about this is it's all your own stuff. So we're not injecting anything chemical. We're not injecting anything that's not from your own body. And the beauty of this is that the human body is a phenomenal thing. And we're just helping stimulate it to do what it does best. And so really like the effects of it, you really can't go wrong. There's always a risk of infection whenever you poke a needle into anything. But very, very minimal. There literally is, we do 2 pokes. That's it. We obviously clean very well, but there's very little side effects with that.
This sounds good. I think, Nicole, we should sign up.
Everyone should sign up.
We should be your testers and let everybody know what we think. I mean, I think, everyone probably at this age, whether it's, you probably have something going on, I would assume, right? At their end of 40s, right? So
Well,
it could help.
question.
It could help anyone.
I am not experiencing a lot of negative things down there yet, but would this be a good preemptive, let's start now and kind of just, I mean, I'm 47. Yeah. I mean, obviously there's changes going on, but nothing's impacting me where I feel like I need to do something. I don't feel like myself. Or do you wait? Like, would you recommend one or the other?
I don't think that a lot of people think that way because we're not necessarily thinking about that unless there's something wrong. But I definitely think that Long term, if you're doing things to help, again, regenerate tissue down there and help keeping it nice and tight, that it will help you more long term. So absolutely, like preventatively doing something. You don't have to do it as often. I don't think. I would do, like once every other year kind of a thing and just see how it goes. But I think that long term you'll be better off.
Okay.
So being proactive is good, not
Correct.
reactive.
Yes.
We like to be proactive in midlife, right? That is like Botox. I mean, it is.
And weight training and eating healthy and taking, fish oil, omega-3s.
The payoff would be better. Allie, how much does, at your place, just in general, if someone was going to go to you in Colorado or find another place, how much is this?
So they're at Renova. We charge, it's $9.50 per shot. We do have a package that when you like buy 3, you get, I want to say it's like 10% off of the whole thing. So even if you don't use, so let's say you have your first one and you're like, boom, optimal, great. You can bank those other 2 for like a year later or another year later. So, but I do say that once we're a little bit older, it takes a little bit more to stimulate. When I say a little bit older, I'm saying like probably postmenopausal. So I'm talking about our like 55 plus women. That it just takes a little bit more to stimulate that tissue and to stimulate collagen. So I do think 3 is optimal. But you will start seeing something even after the first.
Okay.
So if someone who doesn't live in Colorado, if they're interested in getting one, how do you make sure it's like a reputable place? Because I'm sure if you looked up OSHA in Boston, there's probably a lot of people just like who give Botox or any of those. We're just using those as examples. But how would someone know to make sure the place was legit if we couldn't come to you?
I honestly doing research, like looking at their website, making sure they're credentialed in the sense that they are a medical professional. Like, so it needs to be a doctor, a PA, a nurse practitioner, somebody that has been trained appropriately. And so there's, and honestly, I would ask, so like when making an appointment and, doing that, say, hey, so who is performing the O shot and, how were they trained? Like what's their training behind it? So honestly, I would ask the clinic, but looking on their website should have a lot of information on it. And you want to know that they can speak to it too. Like you want to see that they have testimonials, of people that have had it. But that's a really great question because you shouldn't just let anyone mess.
Don't go straight for the
no, like
Groupon,
anything with your body.
Do not go for the Groupon.
Do the Groupon. Oh my God, do they still make Groupons?
I think they do.
Like they do?
I think they do.
Oh my God, that was like a huge thing in the 20s. Okay, I love that. And how do we find you, Allie? What's your Instagram?
At Renova_med. And yeah, there's a lot of information there too. I think we have like on our highlights, there's a lot of testimonials about the OSHA and women's health regeneration, and women's wellness. I think so. We have a whole lot of other things that we do for women's wellness that helps out with that. But definitely the OSHA is a popular one. We do a lot of it.
Amazing.
Oh, yes. You're so helpful. Yeah, check out her Instagram just because she has lots of good information on there about skincare and healthcare and sort of all that stuff. You guys sort of do it all. I know when I was out in Colorado with Nicole, I met you in person and we went to your place. So it is a special place with all those ladies that are really like so nice.
The best place. Like when my kids go back to school in the fall, I'm coming in for lunch. Like I just want to hang out with you guys. I love you guys.
Nicole wants to work there.
Just to hang out with you guys.
Yes. Come hang out.
Okay, so we've given lots of advice, but Nicole, what would be sort of like your one little bit of advice today?
Oh, geez, Alex, I was not prepared to give unsolicited advice.
Besides get the OSHA. I mean, that's obviously advice. Like, you deserve it, ladies.
I guess lean in your curiosity, because I have heard of the O shot. When I go to Allie's clinic, I see, information out there, and I just have been thinking like, oh, I'm not there yet. I don't need it. But, in asking Allie, she said it's a good idea to potentially think of this as how did you word it? Like proactive type of preventative.
Proactive.
Yes. So be
proactive.
Get curious. Yeah.
Yeah.
I like it.
Yeah. Okay. Get curious. Lean in. I like that, Nicole. Good
What's
job.
your unsolicited advice, Alex?
I would say, lean into your intimate relationship, right? Like talk to your partner about your sex life and how do they envision it? How do you envision it, right? Because it's a journey as well. Like what we're doing or your expectations in our 20s, 30s, 40s, 50s are different. So, I view it as one of the most sacred things of a marriage, and I think it's really important to do. So I think just bringing up the topic, maybe it's not comfortable for you, or maybe your spouse is really excited about talking about it. I don't know. Just keep on revisiting it, right? Because it can be really fun, and maybe you need to add some spice and fun to it too.
Turn up that dial.
Just saying. Turn it up. Turn it up.
You.
Allie, I know you gave us lots of advice.
No,
What'd you say?
Men, when we have a lot of people that are like, oh, don't tell my husband I did this procedure, like how much it was. There has not been one husband that has disagreed or like, oh, you want the OSHA? Here you go. Like, have at it. Yeah. They are very accommodating for that.
I'm sure.
Right. It's a win-win for both people, I think.
Yeah.
Yeah.
100%. So my unsolicited advice is be unapologetically selfish sometimes. I think that again, as women, we give so much of ourselves, and then we just think that that's part of our nature, and then that's what we do, that we get to enjoy that part of our life too. And I like how you said, just communicate with your partner, and because things change and your desires change, the things that you want changes, and they should be a part of that just as much as you. And so I think just being unapologetically selfish a little bit is okay.
Oh, I love you.
I love you too.
I love you guys.
I love you too, Nicole. I love you all. This is like a love fest. Oh my God. Thank you, Allie. We're going to have you on for part 3. I think we got to talk to you more about lots of stuff. So thank you so much for your time. And we'll talk to you guys soon. Bye.
Bye-bye.